everyone, Leslie Cornwell, Midwifery Business Consultation. The next section I want to talk about is the quality assurance and policy creating. These are ones I think midwives tend to push off doing because it's a lot of initial up work to do. And it's hard to see the direct benefit of it, but I really want to stress the importance of having quality measures part of your birth center, short-term, long-term, and easy access policies for things you're going to be doing throughout the day, the office flow, the clinical care management, because these are going to be the things to have your midwifery staff reference to make sure that everybody's on the same page for management style. And if there's a lawsuit or a concern with safety, the policies, the scope of practice, the relationship with the collaborating providers is going to be the big thing they look at. For a protection standpoint and a safety standpoint, quality and policies are really important. So when you're planning your birth center, make sure you make time to do these things. We have with our practice a good chunk of policies, procedures, and templates if you want to save some time, and then you can customize them to your practice. That's an easy option for you. I know I wish I would have had them when I created my birth center because I think so many practices just rework the wheel. There's national standards, there's local standards, but if you had templates for most of the policies, quality assurance processes, which are on our website, it will really save you some time. So some of the things I want to talk about: quality assurance, having updated policies and procedures. So whether you're an established birth center or you're starting new, if you're starting new, you're going to have them created for the first time. But if you're at a practice where it's crazy busy and you're just trying to do all the care and you don't have the staff to keep up with the policies, once they start getting a few years old, and even CABC, if you want to be accredited, they have to be kept up so many years. I mean, the recommendations are every 3 years. I personally say every year, just glance at them, make sure that there's no significant research, articles, standards that have changed, that you're consistent, your common practice is reflecting. I've worked at a lot of places and been part of a lot of practices where what everybody is doing is not what the policy says, and that puts you at a lot of risk of you're not being consistent with what your standards are expected out of you. I've worked at places where it's 10 years since they looked at the policies, and the standards 10 years ago are not the standards now, and it makes it really tough to give good, safe care and protect yourself legally with outdated standards, outdated policies, when the paperwork and the backdrops isn't current. So having resource articles, having memberships for your midwifery team is really important. So up-to-date, evidence-based birth. I had probably $2,000-3,000 worth of books, depending on the style of your midwives. If they are more older and they like the books and the things in their hand to look at, so the newborn assessments. There's a lot of great Ina May books. There's a lot of great, Varney has a lot of great books. There's the lactation book, human lactation. So it just depends on the style. So I had a resource library, but I also had a lot of internet access because the studies change. You want to have an ACOG membership. You want to have an ACNM membership. You want to have a MANA membership. You want to have AABC, all these memberships, so you can keep up with trends and resources. Because if there is some states having a great luck with insurance reimbursement on this code and presenting this article, you're now going to benefit from that wealth. So keeping up with those organizations is really important with quality. Peer review, make sure every few months you do a few random chart audits, and it doesn't have to be the bad situations. Stress just as much as the good as the bad, because I think our society spends so much time in healthcare. Well, we're just going to focus on bad, and that doesn't, you want to stress that most of the care you're giving is phenomenal and amazing, but there's little things we can improve here and there. So having a system, having a near miss protocol, having, if there's a bad outcome, what are the steps you're doing, the education, the drills, all those things are really important with quality. Keeping up with the competencies, doing, if you've got CLIA, which is involved with the lab, so urine dipsticks, blood draws on site, wet mounts, pregnancy test, anything with lab, you have to have a CLIA for your birth center, and there's competencies involved with that. So definitely keeping up with those is really important, so you're following state and federal guidelines. Even if you don't want to get CABC accredited, because it is a little expensive in the beginning, but it's really important to set up your birth center to those national standards, the indicators that they're recommending. Every state's different if you have to be nationally accredited or just need a state license. In some states, there's not either one required. So you just have to know your state laws and what has to be in the birth center, what policies have to be placed, what quality measures you have to reference if the state comes to look at your birth center, and make sure your license is current. How you're training your staff, your orientation evaluation process is part of quality. Having easy reference books for them as they're new, birth assistant training, your call schedule, how to get a hold of each other, the chain of command, if there's a concern that arises, those are all really important things to have in writing so everybody's on the same page. And that'll help you as the medical director, the clinical director, decreasing phone calls of questions the more you have in writing for everybody to reference to train each other. Yearly evaluations, 90-day hire evaluations are really important, especially if your employment contract has that 90-day probationary period where you want to make sure, yep, they're a good candidate. Nope, you have concerns, you have it documented, especially in the next section when we talk about hiring and firing. It's really important to have documented evaluations, because if you say I'm going to fire somebody for unsafe care, but you don't have anything documented the last year for that, it doesn't look good. So just for legal protection. We talked about the orientation process and making sure you have staff meetings. Regular communication among your team is really, really important. Phone calls, in person, education, learning from each other, and keeping everybody on the same page to the things happening in the community. Administration policies, there's different categories. There's administration policies and there's clinical policies. So the administration policies is the flow of your office. So the job descriptions of everybody, employment contracts, patient intake forms, questions asking, phone etiquette, attendance, tardiness, education, disciplinary plan of actions, marketing strategies, inventory restocking. Those are all administration policies. If something's running low, which item do you order if it's this amount? And so then your staff knows a clear expectation how you're going to check for expired meds. Once a month, you're going to check over your equipment, make sure everything works well, that your medications, if stuff's starting to get low, that the inventory and everything, because that's what keeps your care safe. Your quality improvement process is part of your administration policies. Your collaborating relationships, whether they're in writing, depending on your state, some are required to be in writing. I had a couple that were in writing. We had the heading memorandum of understanding, just that this was what I would call you about. This is what we have as a relationship. This is the way to get a hold of each other. Some states require you to have something in writing in a very specific document. And then I had many informal relationships. When you serve a large radius, you want to get networking connected with a lot of people, pediatricians, obstetricians, family practice, MFM, to help give safe care and co-management options for different areas. Because not all your women they're going to drive 2 hours for you, and you want to know not just in your town, but your surrounding towns, some good networking medical resources. So patient education, patient hands-out, your patient paperwork, I would strongly encourage, have a lawyer look at, have other midwives look at, make sure that the verbiage is protecting you and your clients. There's no misinterpretations. It's very clear. So those financial agreements, whether they're paying cash or insurance processing, the HIPAA forms, their rights if they have concerns with your safety, like the chain of command that the patients can talk to on a state and a local level. Those are all very important things that you need to have for protecting your practice and protecting the families. I personally would have a policy about the risk out criteria and the scope, and it's a form that the families sign at the beginning so they clearly understand, no, you don't have a C-section in your birth center. No, if minutes matter and you have an emergency situation, this is the closest place to your birth center and this is our plan we have in place. So families have a clear expectation of what they're choosing. Don't make assumptions just because they choose a birth center, they know what that means. What is the scope of a midwife? I had some people frustrated with me because they really wanted this option of care, but it wasn't within the scope of a midwife. And I don't know if it's hard when you're so emotionally invested that, no, I can't take care of high risk independently. This isn't a safe setting for you to deliver. And sometimes having those conversations at the beginning, just really reinforcing what a midwife is, what our scope is, and what we can do for you independently and what needs to be worked in a different setting because of our skills, training, and resources. So clinical guidelines, just for legal protection, really have in details your scope of practice, your educational background, your certifications you're keeping up with, so your NRP, your BLS, ACLS, stable, PALS, whatever certifications you feel you need to be able to safely care for families. I had it for inpatient OB and electronic fetal monitoring, but that doesn't really apply to the birth center. So depending if you're going to have hospital privileges with your birth center transfers, you need to determine which first assist, circumcision, all those extra things you want to have as part of your scope and have them in writing. What does the training look like to be able to have that skill? Risk out criteria we talked about already, what you independently care for, what needs to be co-managed with an obstetrician, pediatrician, and what just directly transfers, especially with more touchy, high-risk situations, breech, twins, VBACs, just borderline things that usually get midwives in a lot of trouble. If you've had a woman that's had pretty significant shoulder dystocias in the past, that's something that makes midwives a little more nervous because of just litigation. So just protect yourself and be conservative in the beginning, and that's okay. And as you get more established and you get a better relationship and you get more women, you can decide if you want to be more lenient on certain, maybe not medically risky, but just certain topics that you have to be a little more conservative if you're doing something new in your area. The last thing, just practice guidelines. I really stress, it's easy when it's in the beginning and you're new, you're going to start all your policies and write them, but keep up with them every 2 to 3 years. Don't let them get outdated. Don't ignore them. Once you've made them, review them, keep them up to the current standards, because they're what will protect you and will help communicate to the end. As you grow, you want all the midwives to be on the same page of suggested management. So look forward to seeing you in the next section. Thank you.